but I would not.
AM 1220 KHTS, HometownStation.com. This is the Prima Pediatrics Healthcare Hour on your hometown station, AM 1220. And we are with Dr. Feldman from Prima Pediatrics, primapediatrics.net for more information. But we're talking about communication, and communications not only doctor to patient, but patient to doctor as well. We were talking about how doctors sometimes use, you said the term doctorese, I believe, is
Doctorese is what I call it.
Yeah. So it's sometimes confusion when it comes to maybe patients not understanding. But there's also the other side of that is patients need to communicate with their doctor as well, right?
That's right. And I think, people say, well, what's the problem here? I mean, you come to the doctor with a problem, that's it, they should figure out what's wrong. Well, the issue is that to begin with, still, even in this day and age, when we're supposedly enlightened and more equal, patients still somewhat revere doctors. Not all the time, sometimes they really unrevere them, but most of the time, they come to the doctor, or you come to an attorney, you come to anybody for help because you respect them and you think they have knowledge to help you with a problem, which means then that you sometimes can be kind of intimidated. People come into a doctor's office all the time, especially kids, but even adults, who get what we call white coat syndrome. You walk into the doctor's office, the doctor walks in a white coat, the blood pressure goes up. So every time they show up in the doctor's office, their blood pressure is up, so the doctor treats their blood pressure when they don't have high blood pressure.
Yeah, it's just nerves, yeah.
It's just nerves. They're afraid they're going to get a shot, which is why in our office, for example, nobody wears white coats. I don't believe in white coats. I don't believe in black stethoscopes. I have a pink one.
Oh, all right.
Sometimes I'll have a turquoise one. Depends on my mood for the day. Sometimes I try to match my nails because the kids think that's hilarious.
Of course.
And sometimes I'll put my giraffe animal on my stethoscope. Anything to distract the child from the fact that they're at the doctor's office and they might get a shot.
Of course.
Because kids think doctor's office shot. And for that matter, so do grown-ups.
Yeah, that's certainly true. So obviously your nerves go up, your blood pressure goes up, you get nervous, and what do people need to do to not let that happen? And you know what I mean? To communicate openly.
To communicate openly. Well, there's several things. First of all, you need to have a doctor who recognizes that that's an issue so that they can get past your barriers. But in addition, the thing that really helps, and I admit that I don't do this as often as I should when I go to see my doctor, but the thing that helps is to write down the questions you had before you come in. Now, I must tell you that there are some physicians, not the kind that I would go to, but there are some who really get ticked off when a patient comes in with a list of questions. They take one look and they go, "Oh, God!"
That seems like the exact opposite of what a doctor should be doing.
Right. But, you've got to remember that doctors are human beings, and, you know what they call the person who graduates last in their medical school class?
I don't. What is it?
Doctor.
Oh, okay.
There are good ones and bad ones in every profession.
Gotcha.
But, and sometimes, and admittedly, we are human beings. And if you've been seeing, you've got 40 patients to see in a day, you're dead tired, your kid kept you up last night, you didn't get enough sleep, everything's gone wrong, you had to take the car in this morning, you come into the room and there's a patient with a list of 20 questions. You go, "Oh, God!"
The straw that breaks the camel's back.
Right. It's like, now, if you're a proper professional, you'll take it and you'll swallow. And you'll say, I see you have a lovely list of questions here. I'm not sure we'll be able to answer them all today. Let me take a quick scan through and see if there are ones that are most important, or perhaps you can ask me the ones that are most important.
Gotcha.
And check them off.
But writing questions for a patient, that's actually a really good idea. My wife does that.
Absolutely.
When we take the kids in.
Because then you don't forget to ask. Because you're always going to forget to ask.
Yep.
Always.
And then you'll remember to ask after your appointment's over.
Yeah, you walk out the door and you say, I forgot to do that. Yeah. I forgot to ask that.
Yeah.
So write down the questions. That's number one. Number two, try if you can to pinpoint what's wrong with you. I'll give you a perfect example. This is how I learned to really answer calls in the middle of the night in a way that was appropriate. And it started out with my being snarky. Okay? A parent calls me at 4 in the morning and says, my child has a cough. Okay. How long have they had the cough? 4 weeks.
Yeesh.
At which point, I'm thinking to myself, a slow burn starts, and I'm thinking, 4 weeks, and you're calling me at 4 in the morning? So I said to them, and what is it that happened tonight that made you call at 4 in the morning as opposed to during office hours? Which I was meant to say, you're such a fool. And then the parent answered me, well, now they have 104 fever.
Yeesh.
Okay, that does require a call at 4 in the morning. And they didn't think to say, I'm calling because my kid has 104 fever. They're tired. It's the middle of the night. They just got up with their sick kid who's been coughing for 4 weeks now has 104 fever. They can't think straight. They're scared to death. They're picking up that phone and calling me because they don't know what the heck to do.
Yeah.
And they can't even concentrate enough to say, he has 104 fever. They're calling, he has a cough. He's been coughing for 4 weeks.
Yeah.
And a doctor has to remember that that's part of the equation.
Gotcha.
That call, which happened almost 30 years ago, more than 30 years ago, taught me such a lesson, because when I heard that, I realized that, yes, I do have to ask that question, maybe not in such a snarky manner, but ever since, when I get a call that seems out of sync, I ask.
There's something different now.
I ask, clearly this has been going on, but something must have bugged you just now, tonight, that you called after office hours. What's the thing that's worrying you?
Okay.
And that's what you got to learn to do. A lot of doctors don't do that. But it helps, if you're not clear in the head,
Yeah.
to try to figure out what it is you're most worried about.
Gotcha. Okay. We're going to talk more about that. We're going to take a quick break. We're going to take a quick break, talk more about patient-to-doctor communication. We already went over doctor-to-patient, but we got to go over... And we're kind of mixing them both, though, at the same time.
Absolutely.
So communication between patients and doctors on the Prima Pediatrics Healthcare Hour on AM 1220 KHTS.
When